Welcome to the Catalyst Podcast. I'm your host, Charles Epstein. Joining me today is Nadia Klekamp, the Director of Integrated Community Education at Chestnut Health Systems. For the last 15 plus years, she has had the opportunity to work with communities to help create community-level change by developing strategies that impact public health. In her current role, Nadia oversees the Chestnut Health Systems Central Region Prevention Department, supporting multiple state and federal projects working across the substance use continuum. In her free time, Nadia enjoys spending time with her family dog and being out in nature, presumably with her dog. She joins us today from Bloomington, Illinois. Hey, Nadia, how are you?
Hey, good morning. I'm doing well. How about yourself?
I'm doing well, thanks, and much appreciate that you're clearing some time to speak with me today. By the way, Nadia, what does being out in nature mean to Nadia Klekamp? Where I live, South Florida, being out in nature requires, well, for those who don't know exactly, I'm in Boca Raton, which is actually West Boca Raton. So we are essentially living in the Everglades. Of course, it's been developed over the Everglades, so there are a lot of creatures that go bump in the night. So nature basically means mosquito netting and a lot of highly repulsive non-native reptiles, just so you know, Nadia. So what does being out in nature mean to you and your family and, of course, your dog?
Sure. Yeah, absolutely. A little bit about me. I grew up on a farm in central Illinois. We had a few horses, so I'm used to being outside, caring for them, riding, all of that fun stuff for many years as a kid. And even as a young adult, I had the opportunity to attend a summer camp, and you could call it quite rustic. So I enjoy that fresh air, grass, the gardens. I'm not a gardener or have a green thumb by any means, but I appreciate the work that a flower garden provides. I do walk my dog all the time, and just an outdoor fire in the evenings is something I really enjoy. Thankfully, being in Illinois, we don't have to deal with any alligators.
Yes. I'm sure you have to deal with something because every region of this country, you have to deal with something, but we're not going to get too deep into
Sure.
that. Anyway, again, thanks so much for taking the time. I mentioned what you've been doing for the last 15 plus years. Does that refer to the work you've been doing at Chestnut? Have you been with Chestnut longer or a shorter period than that?
I have been with Chestnut. Just this past spring, I've celebrated my 15 years here with the organization.
Oh, okay. Well, congratulations. And what did you do for that? And I'm curious how you came to this work. It's always an interesting conversation with your colleagues because people come at this in a variety of ways.
Very much so. So I was a graduate amid the Great Recession. And so I kind of stumbled upon this role. Prior to my time serving at Chestnut, I worked multiple roles, customer service, office management, anything to help me keep moving forward. Honestly, I came into this role, a friend referred me to this open position. There was a position posted to look for someone to help develop and implement community prevention campaigns out in a county and a rural community, which I am familiar growing up in one. And I have a communication and art background. And so I applied, I was able to get hired and started working in that community. I found that I really started enjoying the work. I found creative ways to help educate youth, parents, the community adults in the neighborhoods. And it was really, every day was not like the other. And having that variety was really exciting for me. Really learning and growing with the community, building relationships with community coalition members. It was very exciting. It still continues to be exciting. I would say I am people-oriented, and this variety is something that still is challenging to me in doing, like I said, the communications, development, design, implementation, but then it kind of leads into doing more of that community organizing and building strategies that impact public health. And that's where we are today.
Very interesting. Your work focuses, as I said in the introduction, on primary prevention and community recovery-oriented systems of care, ROSC. For the non-specialists in our listening audience, what is recovery-oriented system of care and why is it effective?
Yeah. So I'll utilize the state of Illinois' definition of recovery-oriented system of care, but broader, it is well known nationally. It is a coordinated network of community-based services and supports. It's person-centered. It's building on strengths and resilience of individuals, families, communities that have experienced recovery or are working to help improve recovery supports within their local communities. The whole concept of ROSC is really, I like to refer to it in shorthand, it's a recovery coalition. So it's a group of community stakeholders, diverse stakeholders that are working to build that infrastructure to better establish or maintain recovery supports within a community. And that recovery is that term for mental health, substance use, or that co-occurring. ROSC is really unique in that it provides an avenue for communities to address needs that, one, they might not even realize needs to be addressed, but two, builds upon that mutual understanding and hopefully helps reduce stigma associated with substance use.
Yeah, I want to talk to you in a bit about bringing together community stakeholders. It's really kind of an interesting thing. But so you've been in the field for 15 years. I'm curious, how has the field or your work or perhaps even your perspective changed over that time? And what are some of the major drivers of those changes?
Yeah. So for me personally, my scope of work naturally has grown and broadened. Like I had mentioned earlier, I was focused in one community, focused in primary prevention. Again, the need had arose specifically to address the local opioid issues. And so that impact of opioids in the community, the use of heroin and synthetic opioids was something that needed to be addressed at the time. But then also knowing that marijuana, alcohol, tobacco are still primary substances that people use. So I found that trend in addressing opioids with the community brought along primary prevention. So while a horrendous impact that opioids have had, it has helped improve strategies in primary prevention. There had been increased community participation is what I have seen over the last 10 years, and people understanding the need for prevention coalitions, but then also this need for recovery. And specific to that change, I have observed that recovery is happening out loud more so than it has previously. More communities are stronger in understanding of what that means and hopefully are getting in positions where they can better support their community members who have been in recovery.
Yeah, come back to something before you move deeper into what you're saying. So the opioid crisis or epidemic, however you want to characterize it, it sounds like that was sort of the catalytic event. Is it just simply the rise in the use of it, or is it also because you're talking about it, how it brings a lot of stakeholders together, if I understand you correctly? Is it because it just cuts across so many communities, unlike perhaps other types of substances?
Yes, I think the emergent need, the impact that it doesn't discriminate. So different facets of each community have been impacted. I think because of that, there is a stronger willingness to address those issues. No one is spared, so to speak. So utilizing that motivation to bring people together to put thoughtful action plans in place and addressing those issues and challenges has been helpful. We've seen a great number of communities increase in their readiness to help support their residents in need.
Yeah, you were about to unpack another thought before I interrupted you with that question.
I was going to transition talking about things that have changed. Funding. I work in grants. The soft money changes. The COVID pandemic was challenging. The aftermath of that brought in additional funding opportunities to kickstart some new endeavors. I personally have seen some of our communities that we serve had the opportunity to increase services because of the COVID dollars, if you will. And so while that has also been a challenging ordeal, there had been some benefits to using that funding to support and expand reach.
So tell us specifically about the statewide ROSC that you're involved with.
Yeah. So the statewide ROSC Leadership Center is a training and technical assistance center that offers support. The Illinois Department of Human Services Division of Behavioral Health and Recovery is funding, at least this current state fiscal year, 47 different ROSC councils to do the work within their respective communities. They've tasked us, the statewide ROSC Leadership Center, to help equip staff, these ROSC coordinators that are working across these 47 councils, to be effective in their communities. So it's a really unique opportunity to work across the state of Illinois. If you're familiar with our geography, it takes about 8 hours from the top to the bottom, and across it's several hours as well.
Same here in Florida, by the way. Actually,
yeah,
may even
okay.
be a little bit more to go from where I
Okay.
am up to Jacksonville. So I'm familiar with that dynamic, although Florida tends to be a little bit wider. But I digress.
Yes. So with that, it's pulling together communities who may not normally interact with each other, but they do have that common ground and wanting to improve their community, wanting to increase recovery support. So this leadership center is really unique, and that helps support these councils, but also allows for the space to make and empower the ROSC coordinator with their collective community stakeholders to tailor the needs specific to that community.
So these 47 councils, I'm assuming they're all geographically based?
Yes. They have defined service areas. Some ROSC councils are a county or two. Some are just a county. Some are a conglomeration of several Chicago neighborhoods.
Yeah, it sounds like a massive project to coordinate all 47, no?
We have a solid team. I am privileged to be the site director of that project, but we have a team of 8 that help support all of these councils across the state. We follow the IDHS regional map. So there's 5 regions within the state of Illinois. So each region has a designated technical assistant. And then we have a training supervisor and a coordinator. And it is massive, but it is really exciting to help build the confidence of these communities to do this work.
Are there any particular councils that pose challenges that may be outliers vis-a-vis the others?
I think each of them have unique challenges ahead, and those can look differently. Maybe it is a specific community sector that they're trying to recruit to participate, but is unwilling. Some have that just those true environmental impacts. Some of our communities or councils are serving counties that are highly rural. So while increasing recovery supports could mean providing access to getting that individual to and from a recovery support meeting, what does that look like? So it is each are challenged in their own unique way, so to speak. Others may be having issues with increasing participation of the entire county. Some have these centralized cities that are the main hub within a county. Others, and they're not getting maybe the support of more rural communities. So it's helping them brainstorm ways to be creative and think outside the box of how to address some of these initial challenges.
Could you distill it all to one fundamental challenge? Is there one particularly thorny challenge that all of them are grappling with, that if we solve that, it would unlock a lot of opportunity?
I think if I had to narrow it down, I'll be honest, I think stigma still exists, and at various levels. And if all of our ROSC councils could help their communities have at baseline an understanding of substance use disorder, the challenges that folks in recovery still deal with on a day-to-day, week-to-week basis, I think that would really help unlock the community readiness.
Yeah, interesting. I promise to get back to the community stakeholder question, corralling all of them. And I know in September, you're going to be involved in a training webinar on engaging different community sectors. What are some of the challenges in bringing various community stakeholders into your projects? I mean, I can imagine generally what some of those are, but I'd like to know what specific challenges you're dealing with.
Yeah. More broadly speaking, I think time. There's only a limited amount of time people have to commit to various things that may be outside of their current work. I think specifically law enforcement is vital in having a successful ROSC council, but that particular sector is very, very much committed to serving and protecting the community. And it is challenging to get a member or representative to come and devote an hour or two to a ROSC council meeting.
In other words, somebody from law enforcement to come. Now, why is that? If they are invested in the community and they see the value, or at least the value is pretty evident, why is that so difficult?
And I don't think it's because they don't want to. I think it's more so they are overextended. Their commitments of serving and meeting the needs of their community, potentially dealing still with understaffing and those kinds of situations. But what does happen more often than not is that the relationships the ROSC coordinators, the rest of the ROSC council members have with law enforcement is positive. So it's more of, if they can't physically be at a meeting, there's still that relationship that begins to get established that they can pick up the phone and, hey, what about this? Can you tell me, what are you seeing on your end? There is that mutual dialogue that's happening.
Yeah. So what are some of the other stakeholders and some of the other challenges that may be specific to them?
Yeah. So I think it goes back to what we talked about earlier. Stigma still exists. And depending on that community sector, I think our businesses, local businesses, more corporate businesses maybe have an understanding, but aren't willing to have the time placed in working on ROSC councils. Some maybe do. I think it comes back to starting with that sector and building a relationship, helping them understand, answering questions, and helping them see the value of why they should be at the table, why they should care. How, if they are understaffed as well, would there be someone who maybe in recovery still looking for employment? Is there a mutual benefit there? And helping business organizations understand the value of a recovery-friendly community.
So have you made significant inroads into the business community?
I think this comes down to each ROSC council's unique challenges. So yeah, we have seen success in equipping those coordinators to help their local businesses, their chamber of commerces understand what the value of participating in ROSC. And we have seen that buy-in and that willingness to participate across the board. Not yet, but who's to say more work to be done. It's really all about relationships, and those relationships move at the speed of trust. And so it is equipping and encouraging those local communities to build rapport.
I'm assuming we're also talking about local politicians, local community leaders, clergy, and so forth.
Yes. Yeah. What is really exciting, and it's an adjacent project that has been really successful in the state of Illinois, is the Illinois Faith and Recovery Collaborative. And that is training faith-based communities in understanding recovery and having the confidence to make those referrals to professionals if they're working with a parishioner who may have a substance use or mental health challenge. And so I feel confident to see that growth happening. Obviously, there's still more work to do, but that is a sector that historically maybe is a little more reserved with buying into being a part of a ROSC council. But we, in the last 3 years, have seen really strong increase in that faith community sector.
How about local schools?
So schools are, I would say it depends on the community, depends on the administrator, it depends on that parent network that understands and supports. Schools, I would say, are similar to law enforcement in that they have limited time and their availability to commit to maybe coming to a meeting. But it's one of those that if that relationship's established with that school board, school administrator, with that ROSC council or a council member, they can give them a call and say, hey, what about this? What are you seeing? So schools have a lot on their plate already. I think really providing them with the resources that have been established from ROSC councils is at least step number one. So I like to say it's a work in progress in that sector.
No, because I can see that as schools being a major ally in this whole process. And I'm sure the same can be said about the so-called political class. It all depends on who you're talking to and in what community.
100%. Yes.
Yeah. Tell us about the McLean County, Illinois initiative. That sounds really interesting.
Yeah, I wanted to highlight this in that it is somewhat unique that we are working across the continuum in this particular county. It's one of the locations where Chestnut physically has a presence, but also we are working through primary prevention and harm reduction initiatives, and there is a local community ROSC council here. And so McLean County, if we're talking geography again, it's the largest geographical county in the state of Illinois. It's however many thousands of square miles. And it is home to Illinois State University, Illinois Wesleyan University, Heartland Community College. It's the corporate headquarters of State Farm. So It is, and then the hub is the Bloomington Normal community. But what's cool is that there are several rural communities around that support and help do business and are a huge part of the economy as well. And, high in grain farming as well, corn, soybeans, all that fun stuff. So we have in our department a team basically working across the continuum in McLean County. So we're just wrapping up our year 10 of our Drug-Free Communities project that has been working with youth in Bloomington Normal schools for the last 10 years. And what's really cool is in those 10 years, they've launched an Unstoppable campaign, which focuses on positive reinforcement of strategies to increase mental health and resiliency skills for youth. And that has really taken off. And it's well recognized within the community and within the kiddos coming in and out.
Why has that been particularly successful?
I think what was unique with this particular campaign was creative, somewhat outside of what the kids had been exposed to previously. Honestly, I think having the support of a Drug-Free Communities grant, along with the SAMHSA Partners for Success project as well, really allowed us to saturate the schools with that prevention material. So that funding really helped increase it, and really getting continuous feedback from students on, I like this, I don't like this, like, how can we improve it? So I think that mixture really improved the reach that we had with that. And of course, our community stakeholders, there has been an active coalition in the community, an active prevention coalition for the last 15 years. And so that buy-in from key community stakeholders is priceless.
I see. So, it sounds like this is sort of the gold standard of what it is you're doing across the board with the ROSC initiatives. Yes?
I would like to be somewhat humble, but we've had success on that prevention side. We are utilizing local opioid settlement dollars to help expand the distribution of naloxone into the communities, and that interaction with relationships that come from that prevention lens and our ROSC coalition lens have helped to build that outreach capacity to get naloxone placed, in addition to establishing vending machines across multiple places within the county. And then, of course, the Recovery Oriented System of Care Coalition, or the council, they're phenomenal. They've really increased awareness of available resources. Once something I think we can't say about all the counties in the state of Illinois is that McLean is fortunate to have a lot of resources. However, I don't know that there's a working knowledge of all the residents to know what's available. And the ROSC has really taken that on to help disseminate information to populations who may not have already been aware of what is available to them.
That's great.
Yeah.
Any other projects or initiatives we've not spoken about you want to give us a little bit of a sneak preview of what's coming?
Oh, gosh. We have various projects within our department. We have recently been awarded new funding to continue the work of our local ROSC councils. More to come with that. We're serving 5 different counties in our central Illinois region. And as an organization, we have a total of 8 out of the state that we are helping to support. Things ahead. We've put in a couple of projects and we're waiting to hear if we're funded or not for those fun things. But it's really continuing the work we have been doing and doing it well, and continuing to foster those relationships of our community stakeholders. And then, of course, the staff professional development. Our team is growing, and we had massive growth in the last 4 to 5 years. And now we have a solid, stable unit of staff who are really, really doing a great job in their respective communities.
Yeah, it's amazing. You're obviously palpably passionate and invested in your work, and you think that this really wasn't on your radar until it came on your radar. Do you ever think about that? So many people just generally outside of this kind of work, very few have career paths that were very carefully planned from a very early age. And so much of it is a series of maybe happy accidents. Do you reflect on that?
I do quite often. Sometimes I joke with my family, I'm still waiting to figure out what I'm going to be when I grow up. But really,
it appears that you found it.
Yeah. I'm fortunate. And it's something I never thought I would get into. I think it's a really important kept secret. It really is adjacent to the healthcare field in educating in public health strategies. There is a lot of marketing and communication that goes into play. And then now in the administrative side, there's a lot of budget management and grant writing and all of that unique opportunities. So I've thoroughly enjoyed it. I'm interested to see what the next 5 to 10 years brings. But yeah, if you ask me as a high school graduate, what would I be doing? Or even as the 5-year-old starting kindergarten, what do you want to be when you grow up?
Right.
I don't think I would have picked this.
Yeah. Amazing. You're doing terrific work. Nadia, really do appreciate your time talking with me today.
I appreciate you having me, Charles. Thank you so much.
Thank you. Today, I spoke with Nadia Klekamp, Director of Integrated Community Education at Chestnut Health Systems. She joined me today from her headquarters at Bloomington, Illinois. This is Charles Epstein for the Catalyst Podcast. Thanks for listening.